Hi guys, my name is Samira. I'm a doctor of nursing, family nurse practitioner, and today we are talking about bioidentical hormone replacement therapy for perimenopausal and menopausal women. I have an amazing guest here today. She is one of our patients who received pellets and she has experienced hormone replacement therapy, and I thought it would be a great idea to hear about her experience and know more about the process from a patient's perspective. Hello. Thank you for coming in today. I really appreciate it. Tell us about yourself a little bit.
Sure. I'm a 42-year-old woman and a mom of two very active boys. I've always valued staying active. I eat 3 meals a day, though it's not always consistent because of my kids' schedules. Don't really have a sweet tooth, don't really drink soda. My main activities that I do to stay healthy as an adult are skiing and biking for about half of the year. But when I was younger, I was a student athlete until about 22 years of age. So I feel like I really had a good understanding of diet and exercise, and I've always made that a priority.
That's awesome. So tell us about how you were feeling, what was missing, what drove you to seek hormone replacement and just thinking about getting tested for hormones, like what was the driving force in there?
About 2 years ago, I noticed an unexpected shift in my body. Despite tracking my macros, switching from cardio to weight training, focusing on a balanced diet, I started to slowly gain weight. When I look back, it was about 30 pounds over those 2 years.
Oh, wow.
My mom pooch became visible. I was constantly buying new athletic gear. My old clothing wasn't fitting, and it really affected my confidence and my endurance. So I thought, okay, I know what to do. I can control my food. I can control how active I am. So I really started to focus on food and exercise. But the weight gain persisted. And it was really hard to hear from loved ones, just eat less or work out more, especially when I was already doing all of those things.
Okay. So you had a little bit of weight gain that you could not manage with your lifestyle, though your lifestyle was basically doing everything right. Your diet was right, you were physically active, you were mindful of what to do, where to do, drinking lots of water.
Yes. And, you know, I kind of was thinking, okay, these things aren't working. There has to be something else. And really what I found was the something else was another woman telling me, hey, have you heard about hormone therapy? I had no idea. I didn't come across this in reading anything about exercise or diet. And so that's when I started looking, and I found Woodinville Family Medicine.
Yeah, you found us.
I did. And at that point, really, my BMI was indicating I was overweight. My blood work was showing high cholesterol. And I really was wearing stretchy pants and sweatshirts just because I didn't feel comfortable. This treatment, the hormone therapy, really felt like it was a new approach and something that really gave me a sense of hope.
All right. So that's a great picture that you gave us, background picture of your lifestyle and how you felt afterward. But let's go into details. So we did your, so we had you on semaglutide, and you were happy with that, with the weight management program, and we thought, hey, let's do something else and even get more out of this. Let's check the hormones. And we figured out your testosterone levels are really low, basically plummeting, and you don't have any reserves in your body to benefit from. So we got the results, talked about pellet therapy because this is what we are doing. So majority of the hormone replacement therapy that we do at Woodinville Family Medicine is using pellets. And so tell me about the procedure. How was it? Painful? How did it go? What you were, experiencing? Because I don't know, I'm just doing my job and, closing off. And
No,
yeah.
I think it was great. I think I also want to say, when I first came to Woodinville Family Medicine, the fact that I was validated in my symptoms, that someone listened to me, that they agreed, that they just didn't say, hey, let's try some medication or let's put you on a prescription. We really talked through what my blood work looked like, how the semaglutide could help, but also where was the hormone missing in all of this. I was in my 40s. I felt I was approaching perimenopause, but again, I just didn't have enough information. So I think when we really started talking about the hormone therapy, I also was being educated on hormones. So for example, I didn't know I needed testosterone.
And that's a really good point, because what we always share with our patients is that we produce testosterone all throughout life as women. And actually, when you measure the amount, a woman produces more testosterone than estrogen through their life course. But it has just been always connected to manly characteristics, something that women don't need, something that makes you look like a man or build muscles and everything. And that's a wrong assumption. It's we are not giving anybody anabolic steroids to build muscles. It's a bioidentical supplementation to your body that basically mimics what you have been getting all through your life up to your 30s, and after 30s it goes down. So that's a great point. Thank you.
So I did feel that. I think the other thing, just to be able to talk with someone else about, infrequent depression, insomnia, the weight gain, really lower sex drive, the things that you're embarrassed to talk about or share, I felt validated. And so really it was an easy decision when we talked about the hormone therapy to just go ahead and do it.
Yeah.
The procedure itself was very quick, which shocked me. There was no pain. I have been fortunate that there's been no side effects. It's been a very easy transition. I am noticing energy's coming back. Brain fog is dissipating. Obviously, my husband's a little happier now. I have just more energy to get through the day. And I'm feeling like me again. And I feel like, as women, we transition so quickly in different areas of health after our 20s. And typically, you are really in or at the end of that transition when you go to a doctor.
Yes. That's a great point. I mean, it was the same for me when I turned 40. For me, it was a lot about my periods. I had really easy periods. Like I used to brag about it to my cousins that I don't even know when I get my periods. It's so painless. I just go to the restroom and I realize I got my period this month. And nobody would believe me. And then I turned 40, and as I went into my 40s, painful periods, really mood swings that I just wanted to dissociate from everybody. I was just isolating myself, really heavy on my mental health. And that's when I got tested. Absolutely, I want to just second on that how important it is for women to share their symptoms, because what I go through with low testosterone may not be your symptoms, but it's good to know that it's different in everybody, and it's important to sit down with your provider, make a list, bring your list and talk about it and see what you can get out of the conversation, how you can put two and two together and hopefully get where you need to be, because this is not like 200 years ago. 200 years ago, we would die at 55. we don't need hormone replacement because just the life expectancy is so short. But now people live into their hundreds, into their 90s. So you are starting to actually enjoy life and receive benefits of your hard work in the 30s, 20s, and 30s, in the 40s and 50s and 60s. You receive the benefits, so why should you suffer because your hormones are going down? And that's such an easy fix. Sorry, I went off the topic.
Well, and I think that's what it is the conversations aren't typical when you go in for an annual checkup or blood work. The conversation isn't hormones, it's how are you doing? This is what your blood work tells us.
Yeah.
You're 40, expect this. So there's no deeper conversations that happen.
Yeah, that's true. And I mean, I think that's one of the reasons that we created 30-minute visit instead of 15 minutes. So we get to kind of dive deep on some conversations with our patients and help them to realize some things by themselves. So all the decisions are shared and informed. So they have all the details, and then they can decide what is the best route to take.
Absolutely. I think the other thing is, is talking with my friends and figuring out if this is the right journey for me.
Yeah.
There also is some stereotypes around quick fixes or wanting to be skinny. And I think what helped me is we really had a deeper conversation about not just the weight. That's a great benefit.
Yeah.
The weight loss is a great benefit, but the endurance, the self-confidence, the other health components that go along with the semaglutide and the hormone therapy, I wasn't aware of either.
Yeah. That's such a good point. Thank you. Yeah. So tell us about, so let's say we have a lot of patients that are going through the same thing. And tell us, what is your message to them? How do you think they should get started? What is the route to take? Like, as a patient, as somebody who has such a great understanding of the whole process, what is your recommendation?
I would say to another woman who's thinking about this or just finding out that this is even possible, don't settle or let your symptoms go unnoticed. If you're already putting in the work, you're not seeing the results, trust your instincts. Think about your body. Maybe there's things your body isn't getting, or because of our age, it's not as strong or it's breaking down. There could be underlying factors that affect your health, and sometimes traditional diet and exercise are not enough. It's okay to seek a fresh approach and get back to a place where you feel strong and confident in your body again.
Yeah, that's a great point. Anything else that you want to share with us today? I appreciate you being here so much, and you have such a good way of explaining things. So anything else that you want to share, we are here to benefit from it.
I just want to say thank you. My confidence is back. My sleep has improved. My days feel brighter, and I feel balanced again. So just knowing that I made the choice, but there was hormone therapy available for me, has really been a big game changer.
Thank you. Thank you so much. I'm so happy that it's working for you, and as a fellow pellet receiver, I know how it changed me, and I know that how it improved my understanding of the process when I received it and my testosterone levels were supplemented. So I appreciate your point of view, and we are both in our perimenopause. So I think the conversation is easier with menopausal women, but for perimenopause, it's still,
Still new.
Still new, and a lot of us don't know. When I talk to my friends, they're like, but we don't need estrogen. I'm like, what we need testosterone, you know? We have the estrogen, yes, we are getting our periods and everything is going well, but we are low on testosterone.
And it can happen slow. And so that was the other thing, is there could be, even with your period, maybe you miss one day or it's lighter.
Yeah.
And so you're like, oh, okay, that's fine. Next month will be different, not realizing you're already in the process.
Yes.
You're just recognizing now.
Exactly. And did you ever had the conversation with your mom or your aunts on the age that, like, what age did you get into menopause?
100%.
Yeah.
So as soon as I even felt one symptom, which was the migraines, the insomnia, feeling hot, or my legs are restless, I reached out to my mom.
Yeah.
And I was like, Mom, when did you go through menopause? And she's like, don't worry. You have so much time. It happens when you're older. And I was like, no, I just feel like things are different. Like my body just isn't working the way it should. Don't worry. I didn't go through it till my 60s. And so even then, I thought, okay, so she didn't go through it then, but then why am I experiencing this?
Yes.
And so that's, I kind of went to my mom first, and then I would start to go to friends in their 50s, friends in their 40s. And as soon as I asked them a question, they were willing to share any information they knew, and a lot of it was hormone therapy.
Yeah. Interesting. Yeah, that's very eye-opening too. It can be different from your parents. That's a really good point, that it can be different from your mom or your aunt. So don't basically dismiss your symptoms as something that cannot be explained. Like, all symptoms can be explained. We just need to spend the time and dig into the lab results and other things, lifestyle, and find what's the reason and fix it, because everybody deserves a very happy, energetic life.
In all areas.
In all areas. Yes, absolutely.
Yes.
Well, thank you so much for your time.
Thank you.
I really appreciate it. And hopefully this video helps for our prospective patients, or basically anybody who has questions and doesn't know where to start. Hopefully this video is a good start point for you to think about it, ask questions, request your provider to do some more labs, hormone testing, start the conversation. If the provider is not willing to have conversations, seek help somewhere else. Our door is always open for you to just come in and have the conversation. You don't have to be our established patient or anything to just go over your lab results and provide you a good interpretation, and just putting the whole picture together and providing it to you. Everybody deserves a good lab interpretation. And one thing that we talked about it off camera, but I want to bring it up because you were such a good perspective on it, was that when you see the lab results, like the LabCorp or Quest send it to you, and you see the normal range, and you're like, oh, I'm in normal range, but that's not the normal range, that's the reference range, and that's taken from the population. So if that population was not healthy, you look at that range and you compare yourself, and it's such a wide range that sometimes doesn't give you any understanding of where you are, where your cholesterol levels are, where your testosterone is. So that's also interesting to actually look for optimal range for your age and your gender, and go off of that, so you can modify your lifestyle better to actually be more healthy and be more prosperous and get more out of life, because we all deserve that. Well, thank you so much.
Thank you.
Thank you. Bye guys, we'll be back.